welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good day, everyone. Start with one simple instruction. Look at fruit differently from today onward. Do not see an orange, an apple, a bowl of berries, or a slice of papaya as decoration on a plate. See it as a daily biological signal. See it as a message sent to blood vessels, immune cells, gut bacteria, skin cells, brain tissue, and even the small protective structures at the ends of chromosomes. Now ask yourself, why do we age? Is it only because years pass? No. Years pass for everyone, but people do not age at the same speed. Aging is shaped by inflammation, oxidative stress, vascular stiffness, loss of muscle quality, declining mitochondrial performance, changes in the gut microbiome, impaired glucose control, DNA damage, and reduced repair capacity. So ask another question. How can something as ordinary as fruit enter such a complex process? Do not expect fruit to stop aging. That is not medicine, that is fantasy. But do expect fruit, used correctly and consistently, to influence several pathways that make aging harder on the body. The World Health Organization notes that fruits and vegetables are important components of a healthy diet, providing fiber, vitamins, minerals, flavonoids, plant sterols, and antioxidants, and that low intake is linked with increased risk of major non-communicable diseases. So listen carefully. Do not chase youth. Support resilience. That is the wiser goal. When we speak about fruit in the context of aging, we are speaking about preserving circulation, cognition, tissue repair, metabolic steadiness, immune balance, and daily function. First, focus on the blood vessels. Why begin there? Because aging often announces itself through the vascular system before we notice it anywhere else. Blood pressure rises, arteries become less flexible, the brain receives less stable circulation, the kidneys work harder, the heart has to push against more resistance, the face may show age, but the arteries often carry the deeper story. So ask, how can fruit help the vascular system? Many fruits contain polyphenols, especially flavonoids and anthocyanins. Berries, grapes, citrus fruits, apples, cherries, and pomegranates contain compounds that interact with endothelial function. The ability of blood vessels to relax, respond, and protect themselves. A double-blind, randomized controlled trial in healthy older adults reported that wild blueberry polyphenols improved vascular function and cognitive performance, linking fruit compounds not just with antioxidant theory, but with measurable human outcomes. Now give yourself a command. Eat color with intention. Blue, red, purple, orange, and deep green are not merely visual qualities. They often indicate phytochemical diversity. Do not eat only one fruit every day and assume the body receives the full spectrum. Rotate berries, citrus, apples, kiwi, grapes, cherries, and melon. Why rotate? Because aging is not one pathway, so your nutritional pattern should not be one-dimensional. Second, pay attention to inflammation. Why does inflammation matter so much in aging? Because the older body may become slightly more inflamed even without infection. Scientists often call this chronic low-grade inflammation a major feature of aging biology. It does not always feel dramatic. It may feel like fatigue, stiffness, slower recovery, poorer sleep, foggier thinking, or less tolerance for stress. How can fruit participate here? Fruit does not behave like a painkiller. It does not silence inflammation instantly. Instead, fruit supplies dietary fiber, vitamin C, potassium, and polyphenols that help shift the body's internal environment over time. The NIH Office of Dietary Supplements describes vitamin C as essential for collagen biosynthesis, antioxidant function, immune function, and wound healing. Many fruits, especially citrus, kiwi, strawberries, guava, and papaya, are meaningful food sources. So do this. Place vitamin C-rich fruit near protein-rich meals. Why? Because collagen is not made from vitamin C alone. It needs amino acids too. If someone eats yogurt with berries, eggs with orange slices, fish with kiwi afterward, or beans with citrus, the meal becomes more physiologically coherent. You are not just having fruit, you are helping the body build and repair. Third, protect the brain. Ask yourself, what is one of the greatest fears associated with aging? For many people, it is not wrinkles. It is losing memory, clarity, speech, independence, and identity. So ask, how could fruit matter to the brain? The brain is metabolically demanding. It needs blood flow, glucose regulation, anti-inflammatory protection, and vascular integrity. Berries deserve special attention here, not because they are magical, but because they are repeatedly studied. In the Nurses' Health Study, higher long-term intake of berries and flavonoids was associated with slower cognitive decline among older women. Randomized trials have also examined blueberry or grape and blueberry polyphenols in older adults, including people with mild cognitive impairment, with some findings suggesting benefits for aspects of memory or cognitive performance. Now use this instruction. Do not wait until memory declines to feed the brain. Put berries into breakfast. Add chopped apple to oatmeal. Use citrus after lunch. Choose whole grapes instead of candy. Why? Because the brain does not age suddenly. It ages through thousands of small daily conditions. Improve the conditions. Fourth, understand the gut. Here is a quiet detail many people miss. Much of the benefit of fruit may depend on the microbes living inside the intestine. Why? Because many polyphenols are not fully absorbed in their original form. Gut bacteria transform them into smaller metabolites that can circulate and influence tissues. In other words, you do not eat fruit alone. You feed a microscopic community that helps translate fruit into biological messages. How do you support that process? Choose whole fruit, not just juice. Whole fruit gives fiber. Juice gives flavor and sugar without the same structure. Fiber slows absorption, feeds gut bacteria, supports bowel regularity, and helps with satiety. This matters in aging because constipation, insulin resistance, appetite changes, and medication burden become more common with time. Give yourself a practical rule. Chew your fruit more often than you drink it. If you want orange, eat the orange. If you want apple, eat the apple with the skin when appropriate. If you want berries, eat them whole. Why? Because the body responds not only to nutrients, but also to the food matrix, the physical structure in which nutrients are delivered. Fifth, consider frailty and physical function. Why talk about frailty in a conversation about fruit? Because successful aging is not just about living longer, it is about standing up from a chair, walking steadily, carrying groceries, climbing stairs, recovering after illness, and remaining socially active. Frailty is a warning sign that the body's reserve is shrinking. A systematic review on fruit and vegetable consumption and frailty found dose-related associations in which higher intake was linked with lower odds of incident frailty in older adults. More recently, a Harvard-led analysis published in 2025 in the American Journal of Clinical Nutrition examined flavonoid-rich foods, including berries, apples, oranges, and tea, in relation to aging outcomes such as frailty, impaired physical function, and poor mental health. Now be precise, fruit is not a substitute for protein or resistance training. Do not make that mistake. Aging muscles need strength work and adequate protein. But fruit can complement that foundation by supporting vascular function, lowering oxidative burden, improving dietary quality, and making meals easier to maintain. So follow this command: pair fruit with strength-supporting foods, put berries with Greek yogurt, eat apple slices with peanut butter, combine kiwi with cottage cheese, add mango to lentil salad. Why pair? Because fruit plus protein is more stabilizing than fruit alone, especially for older adults who need muscle maintenance. Sixth, look at the skin, but do not become superficial. Why does skin age? Because of collagen breakdown, ultraviolet damage, dehydration, inflammation, glycation, and reduced repair. Fruit cannot erase time from the face, and we should not promise that, but it can support skin biology from the inside. A systematic review and meta-analysis of randomized controlled trials on oral fruit or fruit extracts and skin aging found improvements in skin hydration and reduced transepidermal water loss, while evidence was not strong enough for some other outcomes such as wrinkle depth or elasticity. That distinction matters. Say it clearly. Fruit may support skin function, but do not sell it as a miracle cosmetic. How should you apply this? Eat water-rich fruits, oranges, melon, berries, kiwi, peaches, and combine them with adequate hydration, sleep, protein, and sun protection. Do not ask fruit to do the job of sunscreen. Do not ask vitamin C to compensate for smoking. Do not ask berries to repair a lifestyle that repeatedly injures the skin. 7th, understand mortality evidence without exaggerating it. Why should population studies matter? Because individual experiences can mislead us. One person says, "My grandfather ate fruit every day and lived to 95. Another says, "My neighbor never ate fruit and lived long." Stories are interesting, but patterns across large populations help us think more clearly. A BMJ systematic review and dose-response meta-analysis of prospective cohort studies found that higher fruit and vegetable intake was associated with lower all-cause mortality, especially cardiovascular mortality. Another large meta-analysis of 95 studies reported risk reductions for cardiovascular disease and all-cause mortality up to high combined intakes of fruits and vegetables. Now interpret this correctly. These studies do not prove that fruit alone creates longevity. People who eat more fruit may also exercise more, smoke less, sleep better, and have better access to healthcare. But when the evidence from mechanistic biology, clinical trials, cohort studies, and public health guidance points in the same general direction, take it seriously. So here is the practical method. Build a daily fruit rhythm. In the morning, choose one high polyphenol fruit, berries, cherries, grapes, or apple. At midday, choose one vitamin C rich fruit, orange, kiwi, strawberry, guava, papaya, or grapefruit if it is safe with your medications. In the evening, if you want something sweet, choose whole fruit before dessert. Why? Because this uses fruit to replace less helpful sweets while adding fiber and micronutrients. But be careful. If you have diabetes, do not eat unlimited fruit. Use portion control and pair fruit with protein, fat, or fiber. If you have advanced kidney disease, ask your clinician about potassium. If you take certain medications, especially some statins or calcium channel blockers, ask about grapefruit interactions. If swallowing is difficult, modify texture. If chewing is painful, use soft fruits, stewed fruit without added sugar, or blended whole fruit preparations that retain fiber. Now repeat the central command. Choose whole, colourful, varied fruit and use it daily. Do not treat it as an occasional garnish. Treat it as a quiet habit that compounds. So, why can fruit be beneficial in aging? Because aging is not only the passing of time, it is the gradual loss of reserve across systems. Fruit can support vascular flexibility, immune balance, collagen formation, gut microbial activity, cognitive protection, hydration, and overall dietary quality. How can it be effective? Not through one heroic serving, not through an expensive extract, and not through sugar-heavy juice. It becomes effective through pattern, whole fruit, daily use, color variety, smart pairing, portion awareness, and consistency over years. Leave today with one instruction. Put fruit where aging begins quietly. In the daily routine. Put it on the breakfast table. Put it beside protein. Put it in the hands of children and elders. Put it in family meals. Let it become one of the simplest ways a household protects its future together. Thank you, my friends. Take care of yourselves and each other, and I'll see you in the next topic with the same spirit of health, family, and shared progress.